Hey everyone, welcome. I'm Myra, your presenter. I am a certified diversity professional with credentials from Diversity Training University International. There's been a lot of talk and disagreement lately about affirmative action in the US. It's causing some real worry about whether we're staying true to treating everyone fairly, especially with the 2024 Supreme Court ruling against using race in Harvard University's admissions policies. People who work in diversity, equity, and inclusion, also known as DEI, are trying to figure out how to keep doing their important work and support the historically marginalized. Our work as DEI professionals is essential. It is about building organizations that welcome everyone and give our team and students the best skills and knowledge. But we're hitting some significant roadblocks. The way many schools select students and how companies hire for diversity challenges Americans' cherished assumptions about merit and individual effort. As a result, these organizations are in jeopardy of lawsuits. Although a minority in numbers, those who believe that giving opportunities to the historically marginalized to help them compete is un-American use whatever resources available to deter DEI practices. They are not the blame. We have all been duped into supporting debunked ideas about merit and who deserves access to higher education and professional jobs. This presentation argues against stepping back from affirmative action. Instead, it suggests embracing it more courageously by viewing the attacks as a challenge to create more legally sound DEI solutions. A list of strategies for affirming DEI work under the prevailing conditions is offered near the end of this presentation. The recent attacks aren't isolated, but part of a bigger community problem. DEI experts aim to remove these barriers so everyone gets fair and equitable treatment. Take the healthcare industry as a prime example. There's a noticeable lack of Black, Indigenous, and people of color, also referred to as BIPOCs, working as healthcare professionals. This is happening even though the number of racial and ethnic populations in the U.S. has been on the rise for the last 20 years, according to census data. BIPOCs patients often don't receive the same quality of healthcare. The disparities can be traced back to a lack of cultural competence, long-standing unfairness, differences in wealth and opportunities, and built-in biases in our systems. Healthcare equity advocates are really worried about how race is used in medical decision-making tools. An example of the problem is kidney health testing, that's been getting it wrong for Black patients for a long time. The inequitable results of this assessment have resulted in too many Black people needing kidney transplants waiting longer than they should, and sadly, some didn't survive the wait. The core issue is a computerized system designed with an automated formula to determine who most needs a kidney transplant. The results treat Black and non-Black patients differently based on poorly conceived ideas about the body size and race of people with severe kidney problems. Ironically, the automated formula was supposed to make healthcare decisions more sensitive to different cultures and races. It has made things worse for Black patients by inaccurately diagnosing their kidney health. Diagnosis and treatment disparities make it super important to recruit more BIPOC healthcare professionals and mandate cultural competence training for everyone. BIPOC professionals bring different viewpoints needed to identify problems quickly. Diversity among healthcare professionals is essential for creating a just and equitable health system. DEI experts play a significant role here. They must keep pushing for more inclusive hiring in healthcare, making sure folks are hired from all sorts of backgrounds, especially those that match the communities the organization is serving. By using hiring techniques based on equity principles, DEI professionals must challenge how things are done and shine a light on how systemic biases in healthcare can affect patient care. They are the leaders in this effort, encouraging everyone to think differently and more inclusively. Adopting a proactive stance in recruitment, which values healthcare expertise and diverse viewpoints, demands confronting entrenched decision-making patterns and highlighting the subtle effects of bias in patient treatment. This endeavor necessitates playing a role as an influencer and change maker. Here are 7 recommendations for making a persuasive case for affirmative action in health professional education and workforce recruitment. 1. Persuasively argue that the profession is not living up to its Hippocratic oath. 2. Describe how outdated and misguided understanding of a meritocracy undermines unfairness. For example, summarize the studies suggesting that GPA better predicts college success than standardized test scores. This challenges the widely held belief that achievement test scores are the best measure of a student's abilities and potential. 3. When recruits are selected from mostly top-tier schools, the organization will miss out on a mix of cultures and backgrounds. The result is fewer recruits who really get or care about different cultures. Interestingly, one study showed that graduates who get into these elite schools based on their test scores, aren't as involved in their communities or keen on volunteering as those with high GPAs alone. 4. Promote the recruitment of top academic performers from a cross-section of universities and colleges, such as Drew Medical School at UCLA, Harvard University, University of California, Davis, and Howard University. We're talking about the top 10% from each place. The way, you get a mix of brilliant minds from different backgrounds. Plus, it's a fair approach that's even got the thumbs up from the Supreme Court. 5. Support your recommendations with research data as much as possible. Include real-life stories about the consequences of failing to address healthcare disparities, such as the earlier one about kidney transplants. 6. Start with capturing the hearts and minds of leadership and middle management. This requires a high-impact case for healthcare affirmative action by emphasizing equity. 7. To navigate the complexities of DEI backlash and legal challenges, it's essential to collaborate closely with legal experts and the HR department. A recruitment strategy grounded in robust and logical arguments about why it is necessary can effectively mitigate legal risks. This proactive approach safeguards against potential legal pitfalls and helps reduce the hesitancy to embrace DEI initiatives. In summary, advocating for affirmative action in health professional education and workforce recruitment goes beyond mere numbers. It's fundamentally about upholding the core values of medical practice, exemplified by the Hippocratic Oath. Critics believe the current system falls short of these ideals. The current attacks demand a bold response to deliver the best healthcare and reduce disparities that threaten healthcare organizations. DEI experts are ideally equipped to guide organizations towards more advanced practices rather than scaling back on DEI initiatives due to legal challenges or stakeholder objections. To be influential, DEI practitioners must be courageous, accepting, and resilient experts. DEI professionals need to be courageous in the face of resistance and pushback. Courage involves advocating for systemic changes and confronting entrenched biases and practices undermining productivity and equity. Acceptance of a wide range of perspectives and experiences is crucial, especially views that oppose valuing DEI. DEI experts must include all voices to avoid a backlash, and they understand that is the best way to learn a thing or two about dissenters. Resilience is critical to sustaining DEI efforts amidst backlash. DEI professionals must remain steadfast in their commitment to fostering an inclusive and equitable workplace, adapting strategies to address new challenges. Expertise is critical. Receiving expert training, credentialing, and continuous learning will keep you sharp and nimble. By embodying these qualities, DEI professionals can lead their organizations through turbulent times, ensuring that diversity, equity, and inclusion remain central to the workplace culture and talent management strategies. Boldly using the 7 recommendations outlined will help in managing the turbulence. If you found this video useful, you will want to check out our courses. Here are just a few examples of courses you can take to support your professional development. Please use the QR code to see the list of DEI-related courses. Diversity Training University International is an accredited organization that designs, develops, and delivers continuing education. Please follow us to learn more.